Infection Prevention and Control Precautions for COVID-19. Part 5. Environmental Cleaning/Housekeeping, Linen and Laundry Management. Housekeeping is defined as the provision of a clean, comfortable and safe environment for the patients and public. Removal of germs such as the virus that causes COVID-19 requires thorough cleaning followed by disinfection. The length of time that SARS-CoV-2, the cause of COVID-19, survives on inanimate surfaces will vary depending on factors such as the amount of contaminated body fluid, such as respiratory droplets, present and environmental temperature and humidity. In general, coronaviruses are unlikely to survive for a long time, once droplets produced by coughing or sneezing. Objectives of housekeeping: general sanitation, cleanliness and comfortable environment. Developing courteous and reliable and congenial atmosphere. Adequate support of motivated staff. Good interdepartmental cordial relation. Ensuring safety of staff, patient and relatives. Quality control of cleaning equipments and cleaning agents. Proper record keeping and feedback. General principles. Healthcare environment contains a diverse population of microorganisms, but only few are significant pathogens. Microbiologically contaminated surfaces can serve as reservoirs of potential pathogens. Contaminated surfaces not directly associated with transmission of infections to either staff or patients. Transfer of microorganisms from environmental surfaces to patients is mostly via hand contact with the surface. Hand hygiene is important to minimize the impact of this transfer. Cleaning and disinfecting environmental surfaces is fundamental in reducing healthcare-associated infections. COVID-19 virus can potentially survive in the environment for several hours or days.
Premises and areas potentially contaminated with the virus to be cleaned before their reuse. Products containing antimicrobial agents known to be effective against coronaviruses may be used. Established cleaning strategies to be used. Remove the majority of bioburden and disinfect equipment and environmental surfaces.
Housekeeping surfaces can be divided into two groups. Those with minimal hand contact, for example floors and ceilings. High-touch surfaces, those with frequent hand contact. High-touch housekeeping surfaces in patient care areas should be cleaned and/or disinfected more frequently. Doorknobs, bed rails, light switches, wall areas around the toilet in the patient's room, edges of privacy curtains. General instructions for cleaning staff. Housekeeping staff should be trained regarding donning and doffing. They must attired in suitable PPE, that is heavy-duty/disposable gloves, disposable long-sleeved gowns, eye goggles or a face shield, and IN95 respirator, shoe cover, when handling and transporting used patient care equipment and while cleaning/disinfecting corona ward. Disposable gloves should be removed and discarded if they become soiled or damaged, and a new pair worn. Cleaning staff should be informed to avoid touching their face, especially their mouth, nose, and eyes when cleaning. They should do hand hygiene before putting on and after removing gloves. If there is visible contamination with respiratory secretions or other body fluid, the cleaners should wear a full-length disposable gown in addition to the surgical mask, eye protection and gloves. Housekeeping staff should wash their hands with soap and water immediately after removing the PPE, and when cleaning and disinfection work is completed. Discard all used PPE in a double yellow-bagged biohazard bag, which should then be securely sealed and labeled. The staff should be aware of the symptoms, and should report to their occupier if they develop symptoms. General instructions for cleaning. Avoid cleaning methods that produce mists or aerosols or disperse dust, for example dry sweeping, brooms, etc., spraying or dusting. Brooms should never be used. Dry mopping using microfiber floor mops. Wash microfiber with detergent and dry well before next use.
Wash the mop under running water before doing wet mopping. Wet mopping of the walls and floors should be done in 3-shift and whenever necessary with 1% sodium hypochlorite. Prepare fresh disinfectant solution and change disinfectant solution more frequently, especially after cleaning heavily contaminated areas and managing blood spills and body fluids. After cleaning, all equipment used for cleaning including mop head should be washed with soap and water, followed by decontamination with 1% hypochlorite for 10 minutes and then dry it in sunlight. It should be dried thoroughly before reuse. Clean the buckets with detergent and warm water and keep them inverted for drying. Blood spills should be treated with 1% sodium hypochlorite and allow 20 minutes contact time. For large spills use 10% hypochlorite solution. Waste segregation should be done according to the waste management rules. Empty the waste and sharp disposal boxes when the containers are 3/4 full. Housekeeping staff should wash their hands with soap and water immediately on leaving the room. Thorough cleaning and disinfection of surface according to the cleaning protocol is more beneficial than fumigation. Common cleaning agents and disinfectants. Freshly prepared 1% sodium hypochlorite can be used as a disinfectant for cleaning and disinfection. Phenol for cleaning non-client area like office room or staff room and also toilets. Alcohol, for example isopropyl 70% or ethyl alcohol 70%, can be used to wipe down surfaces where the use of bleach is not suitable, for example metals. Cleaning and disinfection of occupied patient rooms or ward. Designate specific well-trained staff for cleaning environmental surfaces. Cleaning personnel should wear PPE and must be trained on proper use of PPE and hand hygiene. Define the scope of cleaning to be done each day. Use a checklist to promote accountability for cleaning responsibilities. Keep cleaning supplies outside the patient room. Follow institutional housekeeping policy. Dishes and eating utensils used by a patient with known or suspected infection, no special precautions other than standard precautions. Patient room, equipment, bed, mattress and including washroom must be cleaned in every shift and whenever necessary. Separate bucket and mop for cleaning each room. After cleaning, all equipment used for cleaning including mop head should be washed with soap and water, followed by decontamination with 1% hypochlorite 10 minutes and then dry at sunlight. It should be dried thoroughly before reuse. Clean the buckets with detergent and warm water and keep them inverted for drying. ICU cleaning. ICU door should be closed all time and clean the door handle with 1% hypochlorite solution. In the beginning of each shift, high-touch areas to be cleaned by nursing assistant. ICU bed rails should be cleaned with 1% hypochlorite solution hourly. Door handle, phone, fridge door, table, chair, stair rails, sink and tap are high-touch areas. Second hourly cleaning as per cleaning checklist for ICUs. Patient room, equipment, bed, mattress and including washroom must be cleaned in every shift and whenever necessary. Terminal cleaning. Terminal cleaning is a complete and enhanced cleaning procedure that decontaminates an area following discharge or transfer of a patient with an infectious or communicable disease, sometimes also referred to as an infectious clean. Terminal cleaning requires both thorough cleaning and disinfection for environmental decontamination. Do not spray or fog occupied or unoccupied rooms with disinfectant, potentially dangerous practice that has no proven benefits. Cleaning should be followed by or combined with a disinfectant process. Ensure room is prepared prior to cleaning, remove medical equipment and patient-used items. Cleaning staff should be attired in suitable PPE, heavy-duty or disposable gloves, disposable long-sleeved gowns, eye goggles or a face shield, and a N95 respirator, shoe cover. Change bed screens and curtains, including disposable curtains or screens, that are soiled or contaminated. Damp dust all surfaces, furniture and fittings. Clean windows, sills and frames. Clean all surfaces of bed and mattress. Mop floor with 1% hypochlorite solution. Wipe down all accessible surfaces of walls from top to bottom as well as blinds with 1% bleach solution. Discard cleaning items made of cloth and absorbent materials and linen into double-bagged yellow bags and seal it properly. Blood spill management. Blood spill kit must contain the following items: PPE, 1% hypochlorite solution, tissue paper or towel or newspaper, wiper, dustpan, yellow clinical waste bag. Spill management steps include the following: spill alert, wear PPE, spread tissue paper above the spill, pour 1% hypochlorite solution, wait for 15 to 20 minutes, wipe up the spillage. Normal cleaning with sodium hypochlorite. PP remove and dispose properly. Hands must be washed. Linen and laundry management. Linen and laundry services are responsible for providing safe, clean, adequate and timely supply of linen to user units of hospital at right time, right place and right price. Types of linen. Linen for housekeeping. This includes curtains, drapes, tablecloths etc. Patient linen include bed linen, body linen, hot linen. Staff linen include doctors and medical staff's aprons, gown etc. Linen management. Estimate linen required to run a given bed. Plan additional infrastructure to keep an uninterrupted supply of linen. Soil linen should be placed in clearly labeled, leak-proof bags or containers. Contain the soil linen in a manner that prevents the containers or bags from opening or bursting during transport. Ensure that all persons who handling the soil linen must use standard precautions and perform hand hygiene after removing PPE. Best practices for linen and laundry handling. Always wear reusable rubber gloves prior to handling soil linen, for example, bed sheets, towels, curtains. Never carry soil linen against the body. Always place it in the designated container. Carefully roll up soil linen to prevent contamination of the air, surfaces, and cleaning staff. Do not shake it. If there is any solid excrement on the linen, such as feces or vomit, scrape it off carefully with a flat, firm object and put it in the commode or designated toilet or latrine before putting linen in the designated container. Place soil linen into a clearly labeled, leak-proof container, for example, bag, bucket, in the patient care area. Do not transport soil linen by hand outside the specific patient care area from where it was removed. Reprocess, i.e., clean and disinfect. The designated container for soil linen should be reprocessed after each use. If reusable linen bags are used inside the designated container, do not overfill them, tie them securely, and launder after each use. Soil linen bags can be laundered with the soil linen they contained. Laundry management of linen. Always use and maintain laundry equipment according to manufacturer's instructions. Always launder soil linens from patient care areas in a designated area, which should be a dedicated space for performing laundering of soil linen. Laundry area not contain any food, beverage or personal items. Floors and walls made of durable materials that can withstand the exposures of the area, for example, large quantities of water and steam. Separation between the soil linen and clean linen storage areas, and ideally should be at negative pressure relative to other areas. Hand washing facilities. Have structured operating protocols and other job aids to assist laundry staff with procedures. Reprocessing of linen. The effectiveness of the laundering process depends on many factors, including time and temperature, mechanical action, water quality, pH, hardness, volume of the load, extent of soiling and model/availability of commercial washers and dryers. No machine washing. Soaked in hot water with soap or detergent in a large drum. Use a stick to stir and avoid splashing. Empty the drum and soak linen in 1% sodium hypochlorite for approximately 15 to 20 minutes. Rinse with clean water and let linens dry fully in the sunlight. Washing machine. Washing by machine with hot water at 60 to 90 degrees Celsius with laundry detergent followed by soaking in 1% sodium hypochlorite for approximately 30 minutes and dried. Transportation of linen. Sort, package, transport, and store clean linens in a manner that prevents risk of contamination by dust, debris, soiled linens or other soiled items. Transport clean linens to patient care areas on designated carts or within designated containers that are regularly, for example, at least once daily, cleaned with a neutral detergent and warm water solution. Thank you for the patient listening.